Hello and welcome to the Hammond Iles Financial Power Hour. This month in October, we're focusing on Medicare and your benefits and making sure that you're aware of the benefits that are available to you, whether you're currently receiving benefits or soon to receive benefits or have a loved one that will need to take or currently taking benefits. Today, you'll get lots of information about not only the background of Medicare and the benefits available to you and your loved ones, but also of some of the upcoming changes that will be happening in 2025. Today, we are always looking for your questions. So as we go through today's presentation, if you have a question, you can submit it one of two ways. You can type it directly into the chat feature in our webinar. Or if you go to the bottom of your screen, you'll see a circle with 3 dots in it, and you can click to raise your hand under that option. It will unmute you and be able to have you directly ask your question. Also, if you're watching this video on YouTube, you can submit your question directly to us at hello@hiwealth.com. Now, today we're joined by a special guest who has been with us for many years, a friend of Hammond Iles, Rob Charnas, who is a specialist on health protection for seniors through Medicare supplements, prescription, and Advantage plans. He is ranked as a premier agent, the highest level of Medicare specialist at United Healthcare and AARP Medicare in Connecticut and throughout the United States. He is certified with the Connecticut Partnership for Long-Term Care, and he speaks throughout the region of healthcare. Let me say that again. He speaks throughout the region on issues of healthcare, including numerous television and radio guest appearances. And we're very grateful for Rob, for you joining us again today to talk about Medicare Made Clean, what you need to know about understanding your benefits. So Rob, with that, I'll turn it over to you to lead us in the conversation today.
Thank you, Greg, and hello, everybody. First, I'd like to say how pleased and honored I am to be selected again to do the annual Medicare seminar at Hammond Iles. I consider Hammond Iles the top financial planning firm in Connecticut, and I know they have offices elsewhere. There are 67 million people who have Medicare, or Medicare beneficiaries. Very few of those take the time and trouble to come or listen to a seminar such as this one. And I have a great deal of admiration for those of you who have joined us, because every year plans and benefits change and prices change. So if you don't educate yourself, you can make mistakes, and they can be in benefits or they can be in pricing. But when we get through with this, I don't think you will make any mistakes. You'll have a very good understanding of Medicare. One of the things that used to happen is I gave these talks live at Hammond Iles, and the people who came in around the table would usually bring in a foot high, maybe more, of mail they had received during this annual enrollment period. And the more mail they got, the more confused they were. And there's just no question that Medicare can be confusing to a lot of people, even those who already have it, certainly those, and I imagine there's some among you who are just joining Medicare or about to. I saw a cartoon in the New Yorker which supports this issue. 2 old men with wings are standing on clouds. They just got to heaven. And one of them turns to the other and says, the only thing I regret is I was just beginning to understand Medicare Part D. So a lot of people have this problem. And there's just one other little story I want to mention, because most people who are entering the Medicare world are a little bit older. And I saw this story and I just thought it was cute and indicative of what it's like to be in the Medicare generation. So this 5-year-old granddaughter jumps on her grandfather's lap, puts her hand across his bald head and runs her fingers down his wrinkled cheek and says to the grandfather, did God make you? And the grandfather says, yes, of course. Then she runs her hand down her own cheek and said, Grandpa, did God make me? And Grandpa said, yes, of course. And so she said, well, don't you think he's doing a much better job now? So that's one of the things that is always a part of Medicare. I want to, before we get into the details, which is the slides in this presentation, I want to give you some history and perspective on Medicare, which will highlight the basic choice you have between what are called Medicare supplements and Medicare Advantage plans. That's the biggest decision you'll have to make. The choice of plans underneath each one is much easier. So back in 1966, Congress invented Medicare, and they created two parts: Part A, which was hospitals; Part B, which is medical, tests, outpatient surgery, and doctor's visits. They didn't cover all the costs. With the hospital Part A, they left about $1,600 deductible every time one went into the hospital. And with Part B, they only covered 80% of the cost. So the government felt that that deductible and the 20% that was left over for us was too much. So they selected a few insurance companies, and they came up with a grid of health services designed to fill those gaps, right? The deductible and the 20%. Those plans were called Medigap policies, which is a term you may still hear. Today, they're called Medicare supplement policies. And they typically cost $200 to $300 a month or more. But once you have them, you pay either nothing or very little for health services. Years went by, and drug costs started skyrocketing. And drugs were not included in Medigap or Medicare supplement policies, so they came up with prescription drug plans and made it a law that if you had a supplement, you were required to have a drug plan or else you get penalized. So another 20 years went by, and the cost of the supplements, the $2,000 or $3,000 or $4,000 a year of premium, was too much for many people. And so the government subsidized something called Medicare Part C or Advantage plans. Because of the subsidy, those plans could cost consumers $0 a month or very, very little in premium. So instead of paying upfront for medical costs, you paid only as you use services. So there'd be little co-pays or co-insurance, if you see the doctor or if you go to the hospital and so forth. And that was able to save certain people who those were appropriate for thousands of dollars a year. However, the choice of one or the other is primarily based on your health. If you have some serious medical conditions, you might have multiple surgeries or hospitalizations, you might have cancer with chemo, even the supplement's high premium added up could be less than the copays of an Advantage plan for hospitals and surgeries and the more expensive copays. So generally, people with serious medical conditions will choose a supplement. Those who don't expect to go to the hospital or have surgery or have expensive tests like MRIs and biopsies, generally pick an Advantage plan. So that we'll talk about in a little more detail as we go forward, but that's the basic decision and the basic way some people can save a great deal of money. Today, more people have Medicare Advantage plans than they do supplements because of the savings. And by law, Medicare Advantage plans have exactly the same medical services that supplements do. That's required. The difference is how you pay, upfront, monthly, or as you use services. There are many other differences, and we'll cover those. I also want to mention that, well, you know what, let me go forward and discuss, we'll take the next slide. And discuss what we're going to be covering this afternoon. What is Medicare? Who can get Medicare? Do you need it if you're going to work past 65? What does it cover? How do you get more coverage? What does it cost? How do you choose, Medicare coverage? When can you enroll? When can you change your coverage, and how you can save money next? So let's start with what is Medicare. Medicare is a federal health program for U.S. citizens and legal residents. It's funded in part by the taxes you've been paying as long as you've been working. It's individual health insurance. It's not family. It's just for one person at a time. It's not Social Security, and it's not Medicaid. And some people confuse Medicare and Medicaid. And if we go to the next slide, it'll discuss what Medicaid is. Medicaid, it helps pay for health insurance, but for low-income folks and families. It is only for that, and each state has their own eligibility level for having a Medicaid plan. It is possible to qualify for both Medicaid and Medicare, and that's called dual eligibility, and we'll go into that in a little bit. Okay, next slide. So who can get Medicare? You have to be a legal resident or a citizen. You have to have lived in the U.S. 5 years, including 5 years just before you apply for Medicare. You either have to be 65 years or older or under 65 and receiving disability benefits, or any age if you have end-stage renal disease or ALS, which is Lou Gehrig's disease. Next. You can, as I mentioned, have both Medicare and Medicaid. It's called dual eligibility. And you can get very special plans funded primarily by the state, which gives you free plans and thousands of dollars worth of additional benefits in vision and dental, many other things. They're wonderful. However, I don't imagine that most of you who are clients of Hammond Iles would qualify for these plans. The typical maximum income you can have this year, it changes every year, is $2,664 for a person and about $3,400 for a couple. And I don't think that most of you would fall into that category. However, you may have relatives or friends that do, and most people don't even know about these special plans. So you'd be doing them a great favor to let them know about the Connecticut Medicare Savings Program. And there is a Medicare Savings Program in every state with different eligibility requirements. Next. Do you need Medicare if you plan to work past 65? Well, two things. One, if your employer doesn't have what's called creditable coverage, which means a plan, a company plan that is similar to a Medicare plan, which is, pretty good comprehensive coverage. And if it has fewer than 20 employees, you are required to enroll at age 65. However, if your company has a creditable plan, 20 or more employees, then you can delay getting Medicare until that ends, whether by you terminating it or the company terminating it. And that's true also if you're on your spouse's plan, company plan. Same rules apply. Next. So Medicare and your employer insurance in rare cases can work together. Typically, your employer insurance is primary and Medicare is secondary. You can't contribute or continue to contribute to your HSA, your health savings account, once you're on Medicare. And remember that in the decision to leave your company plan and pick up Medicare, most company plans allow you to have your family members a part of it, especially children, where Medicare does not. So if your children are under 65 and you want to switch to Medicare, you're going to need to get possibly expensive insurance for the kids. So that's a consideration of whether to continue your employer plan if they let you or move to Medicare. Next. What is Medicare covered? As I mentioned earlier, you get two parts. You get Part A, which is hospitals, and Part B, which is medical. And this is called original Medicare. It's the plans that have those gaps I mentioned. Next. So Part A, in general, is hospital, but it covers rooms and meals, special care units like intensive care, prescription drugs and supplies that are used in the hospital, all kinds of tests, operating room, recovery. I'd like to mention skilled nursing services. That's available in the hospital, and Part A, I'll go into, allows you to get some of that outside of the hospital. Blood transfusions, hospice, and some part-time skilled care for homebound folks, and rehab services after a qualified inpatient stay. So quickly, Part A is free premium. Whoops. There we go. Part A is free. There's no premium involved as long as you've worked for 10 years and paid taxes. You can't be denied coverage. It's nationwide. Coverage and cost are per benefit period, which is 60 days. And you must be admitted as an inpatient, not on observation status, to get many of the benefits. And hospitals can get some personal individual benefits by saying you're on observation. So you need to know what they put down for you and argue that you want to be an inpatient, even if they just give you an aspirin. So it's treatment. And you get 60 lifetime reserve days beyond those benefit periods. Next. Part B, doctor's visits, outpatient care, tests, wellness visits, laboratory services, x-rays, MRIs, CAT scans, EKGs. There's a list of free tests and free services like smoking cessation, obesity counseling, diabetes screenings, things like free colonoscopies and mammograms that are available, mental health care, physical, occupational, and speech therapy, durable medical equipment. Again, we're on the 80-20 situation here, ambulatory surgery centers, and telehealth visits are included in Part B. Next. So Part B does have a monthly premium. Next year, the basic premium is $185 a month. It does not go to an insurance company. It goes to the government. It's either deducted from your Social Security, or if you're not receiving that, the government would bill you, usually 3 months at a time. $185 is the basic charge next year. And then depending on your income, they can charge you more. It's called IRMA. So if you're making more than $100,000 plus a year, or 200,000 if you're filing jointly, that 185 goes up a bit. And you can't be denied coverage for this. It's nationwide. There is a penalty for late enrollment unless you qualify for a special election period, and we'll go into a little more of that. Next. What it doesn't cover, right? I already mentioned that hospital deductible and the 20%, but it doesn't cover prescription drugs. It doesn't cover routine dental, vision, or hearing, eyeglasses. There may be discounts, but it doesn't really cover those. Long-term care doesn't cover excess charges. Medicare allows providers to charge 15% more than the Medicare approved amount for any given service. However, in Connecticut, that's not allowed by law. But I know I have some people here from Florida and Vermont, and you may be subject to excess charges, but they are capped at 15% over the Medicare approved rate. And care is often limited to the continental US, with certain exceptions depending on a variety of things. Next. So where can you get more coverage? How do you fill those gaps? And as I said earlier, and I won't go into too much detail here, because I already did, is you can either get a Medicare supplement. You're required to add a drug plan, standalone drug plan. That's one approach. The other is to choose a Medicare Advantage or Part C plan. Most of them, almost all of them, include drug coverage. And they combine A and B. Their copays and coinsurance either help cover those gaps or cover them completely, depending on the plan. They also tend to offer a lot of additional benefits that supplements don't, or supplements may offer just discounts. Additional benefits included things like eyeglasses and lenses can be discounted. There's a benefit usually in dollars you get, and lenses are typically free. You can get dental coverage, sometimes with a rider, sometimes it's built into the initial premium, if there is a premium. So it has usually a long list of additional benefits that are not included in the supplements. Okay. If you do choose an Advantage plan, you are still in Medicare, right? As I said earlier, that these are programs that the government subsidizes. The government has allowed these insurance companies to manage parts A and B, whereas with supplements, the government still manages A and B. So with a supplement and a prescription drug plan, you need your Medicare card, your supplement card, and your drug card. With an Advantage plan, typically one card covers everything because it's sort of an all-in-one plan. And they're only offered by private insurance companies. And I've covered some of the other things on this, so please go to the next. All right, we've covered this, I think, pretty well. Go to the next. There are many types of Advantage plans, but there are really only two main ones that folks really need to be concerned about in Connecticut. And those are HMOs and PPOs. HMOs are plans where there's a network and you're required to use network providers based on that carrier. Then there's a PPO. Those you can use network or out-of-network providers. Typically, there's an upcharge for out-of-network providers, but it does give you a lot more freedom. There is a third kind of plan, which is this dual special needs type plan, which again is a combination Medicare, Medicaid, and requires quite a low income to qualify for. But again, it's really a blessing if you know people who have low incomes and could benefit from a free plan with many extra benefits. We can go to the next. So quickly on Advantage plans, you have to stay enrolled in Parts A and B. You can't be denied for financial or health reasons. You might be required to use provider and pharmacy networks. The costs vary by plan and they often change each year. There is something called an annual limit on out-of-pocket costs, which is a great safety net for you. Even though as you use services, you have to keep on paying, right? Those copays or co-insurance. Every plan is required to cap those. Most of them are around $6,000. So even though you only expect to have, minor medical services and only have $200 or $300 a year worth of expenses, it's possible that you get a terrible car accident, you have multiple hospitalizations and surgeries. And if those copays start adding up and hit that 6,000 or whatever it is for that plan, everything else is free. So you can look at your Advantage plan upper limit. That's the most you would risk by getting an Advantage plan. Although I have well over 500 clients, no one has ever had copays and co-insurance to come near that limit, which is good, I guess, but it does give you some peace of mind. Some plans have a zero premium, some plans charge you a monthly premium, typically much, much less than a supplement. It can be $0, $29, $35, that kind of level. You have to continue to pay your Part B premium to stay on these plans. Okay. Now we're going to go to your prescription drug coverage. And Greg alluded to some big changes, and it's in this area. And they are very significant, all positive, and we'll come to them. First of all, you can get a standalone prescription drug plan, or you can get one that's built in to an Advantage plan. Next. They cover almost all drugs that are prescribed for Medicare beneficiaries as determined by federal standards. Every plan has a formulary, which is a list of drugs they accept. However, the plans also allow the doctor to ask for exceptions if it's not included in the formulary, and typically those are approved. They might have a higher copay, but they are typically approved. If not, what most people do is they'll switch to a comparable drug. In most cases, there's more than one drug treating the same condition. And there are commercially available vaccines that are not covered in Part B that are covered in most drug plans. I'll just mention something that is not typically known. If you have an infusion or you have an injection that's done in an infusion center or hospital, that is covered by Part B. Prescription drug plans are typically take-home pills or injections. Okay. Uh, there is a stage which I'll be coming to called the initial stage, and all your drugs are grouped into tiers. Um, it's a good idea to give your agent or find out what or provide your list of prescriptions. And your agent can tell you exactly what your copays are going to be during that year based on looking up their tiers. Tiers 1 and 2 um, are the least expensive copays, and those are generics. Tier 3 are popular brands. Tiers 4 and 5 are rare specialty drugs. And considerably more expensive. Um, there may be deductibles also in addition to the cost per tier. Okay. So there are different stages. And the biggest news of all is that this year, the dreaded donut hole or coverage gap stage has been eliminated. That was promised for many years, and it's finally happening. The first stage is your deductible stage if you have one. Some plans do, some don't, some for certain tiers and not others. Then, until you reach a cap of $2,000, which is what you pay in your copay or coinsurance, plus the retail value of that drug. When that reaches 2,000, which can be pretty quick, you stop paying those tier copays and you pay nothing. Last year and past years, when you got up to about $5,000, you moved into the donut hole coverage gap, and you had to pay 25% of the retail cost of the drugs. And some of my clients with cancer and rheumatoid arthritis issues had drugs that might be $3,000 or $4,000 a month. So 25% was very expensive. Others were hundreds of dollars. And they really had a serious problem during that donut hole. 25% of generics was nothing much, but if it was brand name drugs, it could be a devastating issue, and it's gone. So my clients are celebrating. And what happens is after you reach that low $2,000 maximum, you enter the catastrophic coverage stage, and everything is zero. They should call it the wonderful stage. Okay, we can go to the next. We went back. We've got to go forward. Here we go. So this is just a graphic that shows you pay during the deductible, you pay maybe partially for the individual coverage stage, stops when you reach 2,000, and after that, you have the whole year, where you're the rest of the year where you're paying nothing, and it cycles all over again the next year. You start back with the deductible stage. Okay. Fast facts on drug plans. You have to be enrolled in A and B. You might be required to use a pharmacy network. I know United, which is the largest supplier of Medicare plans in the country, has expanded their pharmacy network to just about everything. Walgreens, CVS, Walmart, Stop and Shop, Rite Aid. So these pharmacy networks are getting very, very big. The coverage and costs vary by plan, and they may change and do change every year. And there is a penalty for late enrollment. I'll go into the details on another slide, but I had a client who was in his early 90s, and he didn't take any drugs until that year. And so he never signed up for a drug plan. He went 17 years with no drug plan when he was required to have one. And the penalty for him ended up $100 and change a month. That was added to his premium for his drug plan and never goes away. For short gaps. That was an unusual one. It's about 35 cents, changes every year, 38 cents a month that you are without a required drug plan. So it might only be, $3 or $6 added to your drug plan premium, but it never goes away. Okay. Now the supplements. Again, we've covered quite a bit of this. It can't be used in conjunction with an Advantage plan. And there are 10 letters A through G plans, although F is a possibility for some people. And by law, the health services on each of those plans are the same, no matter what carrier you use. So it's exactly the same health services. The difference is the premium primarily, and then there are usually some minor additional things you can get with some of these plans, like free gym membership. These plans have no network. They're nationwide, and they're offered by private insurance companies. We'll go to the next. All right. They're designed to pay those gaps. The Part A deductible, right? The Part B 20%, the first 3 pints of blood. Instead of just 60 extra days with this plan, you get a year, 365 extra hospital days lifetime. It gives you hospice care. It's rare. I don't know why they can put this down, but there's a Part B deductible. Next year, it's $240 annually for Part B services. And I've never seen a plan that covers those, but it's possible. They typically will offer foreign coverage, depending on the letter you choose, that A through J. Usually it's not 100%, it's 80%, where everything else is 100%. And it does not cover prescription drugs, routine dental, vision, hearing, eyeglasses, contact lenses, hearing aids, and long-term care, custodial care. Okay. This is a real detailed chart of the services offered by each plan. I would need maybe an extra half hour to go over this. So I'm not going to go over each one. But this chart is available to you. If you just contact me, I can get it to you. There are only 2 of these that are typically purchased in Connecticut. So it makes it much easier. It's Plan G and Plan N. Plan G has a monthly premium of $265 in the AARP plan, which again is about as low as you can get. There may be others near it. And there are also others a lot more. But you pay that, and then you basically pay nothing for hospitals and tests and surgery, right? So it's just that monthly payment. The only difference is foreign travel, where it only covers 80%, up to $50,000. And that plan, the only other one that people typically get is Plan N. Plan N is identical to Plan G with these exceptions. There's a $20 copay for a doctor's visit, any doctor, any kind of doctor. And there's a $50 copay to use the ER. And that's it. And in AARP, the monthly premium is $206 for Plan N, right? So there's a saving of $60 or so between the 2. And those are the ones that basically really the only ones that people get in Connecticut. There are some other unusual plans, L&M, which pays just a fraction of what the actual medical costs are. Sometimes they have cutoff points, but they're very unusual. So it's G and N. Okay, next. You still have to be enrolled in parts A and B. There's the issue of medical underwriting. If you enroll at the normal time, which is within 6 months of your initial enrollment period, you don't have underwriting. There are also, depending on the state, all kinds of different rules about health underwriting and exceptions. And I'd have to tell you sort of off this seminar what those are for your state. But in Connecticut, it's guaranteed issue. It's one of the 3 guaranteed issue states. So there's no medical underwriting. But there would be in most other states. Again, national coverage, no network. Every provider and hospital that accepts Medicare has to accept Medicare supplement. They're renewable, guaranteed, as long as you pay your premium. And premiums do vary depending on the letter of your plan and the carrier. And you do have to just continue to pay your Part B premium. Okay. So how much does Medicare cost? The cost factors are a monthly premium, if you have any. Many Advantage plans have 0 monthly premium. A deductible, if there is any. Some plans have them, some plans don't. They're more common in the drug portion of your plan. Sometimes there are copays, and sometimes there are co-insurances. If you have original Medicare, you know your basic co-insurance is 20%. But once you have a supplement or an Advantage plan, those are either eliminated or reduced. Okay. Again, I've kind of gone over this, but just briefly. Medicare Advantage, right? 0 or low monthly premium, sometimes deductible, copays and co-insurance. Part D prescription drug plans typically have substantial premium, not as much as supplements, but substantial. Often have a deductible and copays and co-insurance. Supplements have a high monthly premium. They have that $240 Part B deductible, and they sometimes have copays. Part G has no copays. So that's a quick comparison of the 3. Next. So how do you choose? You have a lot of alternatives. If you go with original Medicare, A and B, you can add a standalone drug plan, or you can add a Medicare supplement, or you can add both. With an Advantage plan, you start with the basic plan. Some plans, almost all plans, include Part D, prescription drugs. And what they're showing here, one is a standalone prescription drug plan, the other is a Part D plan that's included in the Advantage plan. So those are the alternative combinations. Okay. And again, this I know we've covered in great detail, right? You can go with original Medicare and a supplement with a standalone drug plan, or you can choose a Medicare Advantage plan, typically having prescriptions in it, with many additional benefits. Okay. Yeah. I've covered these. I don't really need to go into this slide. So when can you enroll? That's important to know. If you're just turning 65, that's called the initial enrollment period. It's 3 months before the month of your birthday, 3 months after. And if you enroll in the 3 months before, your plan will start on the first day of the month of your birthday. Even if your birthday is the 15th of the month, it'll start on the first of the month. So that's the initial enrollment period. And my advice to most people is to do it in the 3 months before. So you start right off with it on the month of your birthday. Okay. There's a general enrollment period if you miss the initial enrollment. You can enroll in parts A and B from January through the end of March. You can enroll in parts C and D, April through June. That's called the general enrollment period. Late enrollment premium penalties might apply. Okay. The open enrollment period for supplements is the 6 months after you turn 65, and it's guaranteed issue. There's no underwriting. After that, unless you have a special election period, those vary by state. You might have to undergo underwriting, which might mean a delay in being treated for a pre-existing condition, or being in some states, being denied coverage, depending on what the health issue is. And there are exceptions in every state. Okay. So the special enrollment period, there are a few very popular ones. The most popular is you have your employer insurance, and you continue with that after age 65. And you're allowed to keep that as long as it's creditable coverage. Employers has over 20 employees, and you do not have to enroll in A and B until 8 months after that's terminated for A and B, and 63 days after you leave your employer plan to enroll in a Medicare Advantage plan. Okay. What are the penalties? Most people qualify for the free Part A unless they haven't worked 10 years. The penalty is 10% of the Part A premium, which is set by the government each year. Part B, if there's no qualification for an SEP, a special enrollment period, the penalty is 10% of the monthly Part B premium for each full 12-month period enrollment is delayed. So that can be significant. And Part D, I went over this, if it's less than 63 days, you don't, without a Part D, you don't have to worry. But if it's over 63 days and you're still without a Part D plan, could be built into your Advantage plan, but you don't have it, then you get this, minor penalty, but it does stay with you. Okay. When can you change coverage? There are 2 periods. One we're about to enter right now, which is why Greg has set this early October date for you to get informed. October 15th through December 7th is the annual enrollment period. Folks with plans can make changes. I get endless phone calls and meetings with my clients during this period who would just like to review, what their options are, what changes there are, if there's anything better for them. Often it's a health change, and that might require a plan change. So those plans, once they're enrolled during that period, start January 1st, right, of the next year. Okay. And the next is something called the open enrollment period, and it's January through March 31st. This is for Advantage plan members only. And during that period, let's say in October, you signed up for an Advantage plan and you live with it for a month or 2 and you prefer another Advantage plan, or you want to go back to a supplement, an original Medicare. This is the period that you can do that. You can switch plans, you can go to Medicare supplements, or just original Medicare if you want. in that 3-month period. And that's if you have an Advantage plan. Okay. There are other SEPs, special enrollment periods, other than the creditable coverage at an employer plan. And the two most common is one is moving. If you've moved into another state, if you've moved out of a coverage area, some states are so big, like Florida, that this would apply if you move from one county to another. And you can enroll in a plan because of that change. Also, some people are on retiree, union, or COBRA plans, and when those end or are terminated, you have a special enrollment period and you can enroll in another plan. Okay. How do you save money? I already covered the biggest thing, which would be if you're healthy enough to switch from a supplement to or choose an Advantage plan over a supplement. But there are other things. There are preventative services, which I mentioned before, a long list, maybe 30 or 40 free services that are available to you. Again, out there, colonoscopies, mammograms, bone density testing, all sorts of things. And I always tell my clients, please review all of these because it's going to help you stay healthy and they don't cost you anything. It does save money to use the provider network, even if the plan lets you go out of network because they're usually less money. If you switch from a brand to a generic drug, if your doctor lets you, usually that's a lower cost. Using the preferred pharmacy network is often important, but the mail order pharmacies, in our case, it's called Optum. United Healthcare owns a company called Optum, and they have reduced the copays if you get your drugs through the mail order service. And also, it's important to understand your status in the hospital. Again, you want to be treated, not observation. And I just want to elaborate a little bit on that. Medicare allows you, if you've been in the hospital 3 days and 3 nights for treatment, not observation, you're entitled to up to 100 days in a nursing home or rehab. There is a copay, but if you have a supplement, that copay is paid for. And if you have an Advantage plan, the first 3 weeks basically are paid for. So if you don't make sure that the 3 days and 3 nights are for treatment, you will not get that 100 days. And the one other qualification of 100 days is you have to be getting better. 20 days are guaranteed, the next 80 days, as long as you're improving a bit, that will continue. So that's that issue, which is important if you do find yourself in the hospital for a few days. Okay. Financial assistance, the dual plans that I had mentioned, open up something called Extra Help, which is part of the Medicare savings program. There are different income levels that you can't exceed, still pretty low. But if you're in retirement and your income is down, or someone who is, it's worth exploring. Medicaid, that's for people with limited incomes. Usually they have to be under 65 to get, in Connecticut, they call it Husky. The Medicare savings program, that's what I mentioned for dual plans. And also they have something called LIS, low income subsidy, for drugs. If you meet those annual or monthly income maximums, you stay below them. And there's a program called PACE, which you can look into for all-inclusive care for the elderly. Next. And there are many, many sources of help. Medicare Made Clear has 3. I'll leave this up for a second if you wanted to jot down any of this information. Okay. And more resources. Medicare.gov, I find very useful. It's the government website for Medicare. And if you want to check on coverage, you go to the search, you put in what procedure you want to see if it's covered, and you'll get an answer, which is very helpful because no plan you buy, including original Medicare, A, B, Advantage, or supplements, will pay for a service that Medicare doesn't cover itself. So that's just a good source. And there are these other sources, including Social Security or the Medicaid office. Thank you for listening to me. And I know, Greg, that we're open for questions.
So again, if you'd like to ask a question of Rob about Medicare and the information that we've shared today, you can enter those questions one of two ways. One is you can raise your virtual hand and you can ask a question verbally, or if you'd like to type it into the chat, we'll be able to answer it for you from there. I'll just give a minute here to either raise your hand or enter your question in the chat.
If I could say something here, Greg,
Sure.
if it's a question that is sort of too personal to make public, Greg is going to give you my contact information, or you can reach me through him. And I'd be happy to answer any of your questions. It doesn't matter whether I'm your agent or not. I'm happy to be helpful.
Right. So let's just kind of share a little bit about how both Hammond Iles as well as Rob can be helpful to you. We do offer these financial power hours throughout the year, as well as the weekly Financial Friday videos. All of the recordings of those videos you'll find on our YouTube channel. Just search for Hammond Iles. You'll also find resources on the Hammond Iles website, which is hiwealth.com. And if you follow us on social media, you also get a lot of that shared with you directly. Also, if you'd like a conversation directly with a financial coach, just go to our website and you can schedule it yourself or contact our office. We'll be happy to schedule a time. As Rob mentioned, he is available to assist you in your decision process. Here is Rob's contact information, both email, phone number, as well as his website on the United Healthcare agent site. So please feel free to reach out to him if you're from out of state. If he's not able to help you, he can certainly help connect you with someone in your area. Just looking at the chat, and nobody has their hands up. So apparently did an amazing job, Rob. So there's no questions, at least, that are going to be asked today. So thank you again, everyone, for taking time out of your day to join us for our Financial Power Hour on Medicare. If, again, you have any questions following the website, please reach out to Rob, or you can reach us directly at hello@hiwealth.com.